Imagine you have $50 million sitting in the bank. You could buy luxury homes, private jets, restaurants, or you could build a hospital. At first glance, a hospital looks like one of the safest businesses imaginable. People will always get sick, people will always need surgery, and healthcare spending in America is enormous. But here's the part most people never see. A hospital can generate millions of dollars in revenue and still struggle to make a profit. Because owning a hospital isn't simply about treating patients, it's about insurance contracts, staffing costs, equipment, debt, occupancy, government regulations, and one of the strangest pricing systems in modern business. So how does a hospital actually make money, and what does it really cost to own one? Let's break down the economics. Let's start with the biggest expense, building the hospital itself. A modern American hospital isn't just a building with beds. You need emergency rooms, operating rooms, intensive care units, imaging equipment, laboratories, pharmacies, sterilization systems, backup power, elevators, specialized ventilation, security systems, IT infrastructure, and enormous amounts of medical equipment. Depending on its size, location, and complexity, constructing and equipping a hospital can require tens or even hundreds of millions of dollars. And that's before the hospital treats its first patient. Then comes another massive expense: people. Doctors, nurses, surgeons, anesthesiologists, technicians, pharmacists, administrative employees, janitors, security staff, IT teams, and management. A hospital is essentially a giant machine powered by thousands of workers, and labor is usually one of its largest operating expenses. Now here's where things get interesting. A hospital doesn't simply charge patients one price. Instead, the amount it gets paid can depend heavily on who's paying. There are broadly three major categories: private insurance, government programs like Medicare and Medicaid, and patients paying out of pocket. And these can produce dramatically different economics. Imagine two patients receive the exact same procedure. The hospital's cost of providing that procedure might be roughly the same, but the amount ultimately paid to the hospital can be very different depending on the patient's insurance arrangement. This is why hospital economics isn't really about the price printed on a medical bill. It's about reimbursement. You've probably seen stories about shocking American medical bills. A hospital might list a procedure at several $1,000s or even tens of thousands. But that doesn't necessarily mean the hospital actually collects that amount. Insurance companies negotiate payment rates with hospitals, so the hospital may have a listed charge of $10,000, while an insurer's negotiated payment could be substantially lower. This creates one of the strangest parts of American healthcare economics. The sticker price isn't necessarily the real price. The hospital wants higher reimbursement, the insurance company wants lower reimbursement, and both sides negotiate. For a large healthcare system, these negotiations can have an enormous impact on the bottom line. Now imagine it's 2 a.m. Someone arrives at the emergency department with severe chest pain. The hospital can't simply say, "Sorry, we're full, come back tomorrow." Emergency departments have to operate around the clock. That means staffing them 24/7, and this creates a unique economic challenge. Even when patient volume is low, the hospital still has to keep doctors, nurses, equipment, beds, electricity, security, and support systems ready. But when the emergency department is busy, revenue can increase dramatically. This is one reason patient volume and hospital capacity utilization matter so much. A hospital with expensive facilities sitting half empty can burn cash. A hospital consistently operating near capacity can generate far more revenue from the same physical infrastructure. And not every hospital service has the same economics. Some services are relatively routine, while others involve extremely expensive procedures, specialized equipment, and highly trained professionals. Think about cardiac surgery, cancer treatment, orthopedic surgery, neurological procedures, advanced imaging, and intensive care. These services can generate significant revenue, but there's a catch. They can also be incredibly expensive to operate. A hospital might spend millions of dollars purchasing advanced equipment. Then it needs specialists capable of using it, technicians, maintenance contracts, supplies, insurance, compliance, and countless other expenses. So high revenue doesn't automatically mean high profit. The real question is how much money remains after the hospital pays everyone and everything required to deliver that service. Here's another way to understand hospital economics. Imagine you own a hotel with 500 rooms. You still have to maintain the building whether the rooms are occupied or not. A hospital is similar, but much expensive. If beds are empty, the hospital still has electricity bills, staffing costs, equipment costs, building maintenance, insurance, technology expenses, and debt payments. That's why hospitals constantly think about capacity utilization. The goal isn't simply to have more beds, it's to have enough beds and enough patients to use those beds efficiently without overwhelming the system. Too empty and you're wasting expensive capacity, too full and you risk overcrowding, delays, staff burnout, and declining quality. The economics lives somewhere in between. Now imagine you've built a hospital for $300 million, but you didn't have $300 million in cash, so you borrowed a large portion of it. Now, every month, before you even think about profit, you have to make debt payments. Healthcare facilities are extremely capital intensive. Hospitals constantly need to upgrade equipment, renovate facilities, expand capacity, and invest in technology. So a hospital owner isn't just managing patients, they're managing a massive financial balance sheet. And if interest rates rise or patient volumes fall, those fixed costs don't magically disappear. This is one reason you've seen so much consolidation in American healthcare. Hospitals merge with other hospitals. Hospital systems acquire physician practices. Large healthcare organizations expand across regions. Why? Because scale can create economic advantages. A large system may have greater negotiating power with insurers, spread administrative costs across more facilities, purchase equipment and supplies at larger volumes, and build a broader network of doctors and services. In simple terms, the bigger the healthcare system, the more leverage it may have. But bigger doesn't automatically mean better or more profitable. Managing a giant healthcare organization can introduce enormous complexity. So how much money can a hospital owner actually make? This is where people often expect a simple answer, but there isn't one. A hospital could generate hundreds of millions of dollars in annual revenue and still have relatively modest margins. Another facility might perform extremely well because it has strong reimbursement rates, high demand, efficient operations, and a favorable mix of services. And some hospitals can struggle financially despite treating large numbers of patients. So when you hear this hospital made $500 million, you have to ask $500 million in what? Revenue? Operating income? Net income? Cash flow? Those are completely different numbers. Revenue is the money coming in. Profit is what's left after expenses. And then healthcare, the gap between those two numbers can be enormous. So what's the biggest risk of owning a hospital? It isn't simply that people stop getting sick. The demand for healthcare is enormous. The bigger risk is cost inflation and reimbursement pressure. If wages rise faster than reimbursement, if equipment becomes more expensive, if insurance companies negotiate lower rates, if regulations increase administrative costs, or if patient volume falls, the hospital's margins can get squeezed very quickly. And because hospitals have enormous fixed costs, small changes in economics can have a very large financial impact. So is owning a hospital a good business? It can be, but it's not a simple business. You're not just buying a building. You're buying a highly regulated, labor-intensive, capital-heavy organization where hundreds of millions of dollars can flow through the system and where a surprisingly small percentage may ultimately become profit. The real business isn't sickness, it's capacity, reimbursement, specialization, and operational efficiency. A hospital succeeds when it can deliver expensive, complex healthcare at scale while controlling labor, equipment, financing, and administrative costs, and negotiating strong reimbursement from the organizations that actually pay the bills. And that's what makes hospital economics so fascinating, because behind every hospital room, every MRI machine, every surgery, and every emergency visit, there's an entire financial system working underneath. And once you understand that system, you realize something. A hospital isn't just a place where people receive healthcare. It's one of the most complicated businesses in America. And that's exactly why the economics of owning one is so fascinating. If you enjoyed this breakdown, subscribe for more videos exploring how America's biggest businesses actually make and lose their money.